The Pear Tree Assisted Living House was founded by 5 registered nurses who understood the challenges people face when a loved one is no longer able to live safely on his or her own. Most of the residents are in their mid-80s to 90s. The first facility was built 10 years ago, and since then a second facility has been built, and plans for a third facility are being worked out. There are presently 2 men living at the Pear Tree, Mr. Dana and Mr. Bill. The rest of the residents are women. A team of nurses and nurses' assistants run the Pear Tree and offer 24-hour care to the residents. The facility where I volunteer has 12 to 14 residents. Each resident has his or her own room with a private bathroom connected to that room. The nurses and nurses' aides help the residents by assisting them in their rooms and helping them with their daily lives. Each resident's needs are slightly different. There are 3 residents in wheelchairs, and they need more help than the others getting into and out of their chairs, getting into bed, going to the bathroom, and with baths and dressing. But nearly all of the residents need at least a little help with dressing, bathing, and what are called the activities of daily living. An assisted living facility like the Pear Tree provides a much higher level of care than what the residents of an independent living retirement community, like the Charlestown community in Catonsville, would receive. But it offers less care than a nursing home, where residents are often on strong medications and are often unable to perform many of the tasks required of them each day. In my dealings with them, I was pleased to discover that all of the residents I have interacted with seem very pleased with the living arrangements they have at the Pear Tree. It's difficult for anyone to give up the home he or she has lived in for most of his or her life, so I was glad to see that the residents treat Pear Tree as their new home and enjoy their fellow residents like they probably once enjoyed their neighbors. The Pear Tree has 2 facilities, each located in Pasadena, Maryland. I have only volunteered at one of the locations, located on Fort Smallwood Road. They are currently searching for a suitable location for their 3rd facility. The Pear Tree offers comfortable living conditions for elderly men and women who need help with at least 1 or 2 aspects of their daily life. The residents or their adult children almost all live within 5 miles of the facility they choose. It is an advantage to the people of Pasadena that a facility like this was built in their neighborhood, providing comfortable and safe living conditions for some of its many long-time residents who are aging in their homes. When grown children can no longer take care of their elderly parents, the Pear Tree is an excellent alternative. With its cheerful staff and enthusiastic volunteers, the Pear Tree is a friendly and comfortable facility for those in our community who can no longer go through their daily lives alone. Its location allows for elderly people who have lived in Pasadena for many years to remain in the same neighborhood. I chose to complete my service hours with this organization because my aunt is currently working there as part of the nursing staff and suggested to me that I should look into volunteering. She told me it would be a rewarding experience for me and that the residents would appreciate whatever help I could provide them. I believe other students should look into this organization as a means of completing their service requirements because it offers a sense of fulfillment. It is easy to tell that the simple thank you the residents give you when you help with a task is more than enough to make you feel good about yourself. All of the residents, as well as the staff, are polite and thankful for the service young volunteers provide. Since I have been volunteering at the Pear Tree, I have had much interaction with the residents. So far, I have mainly helped with the preparation and serving of dinners. I usually help prepare and serve the residents their salads, serve them whatever they choose to drink with their dinner, and then I help prepare the main course of the evening. One night, the main course was chicken, and another, it was sausage. I have chopped tomatoes and carrots, sliced cucumbers for the salads, and then prepared the individual servings. I also help clean up the residents' seats when they are finished eating. Before dinner, many of the residents enjoy talking to the volunteers, asking various questions. I have come to know a number of the residents rather well during my time at the Pear Tree. One resident discussed how much she enjoyed studying anatomy while in college, and how it served her in her career in delivering health care. Miss Bessie was proud to show me the photographs of her family members. The photos were taken at her 90th birthday party. The residents seem to enjoy my company and help as much as I enjoy having this opportunity to get to know them and spend time with them.